SDG 3 is to ensure healthy lives and promote well-being for all at all ages. Within SDG 3 are 13 targets, of which we here focus on Target 3.8, which is achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Target 3.8 has two indicators. Indicator 3.8.1 is coverage of essential health services, and Indicator 3.8.2 is proportion of population with large household expenditures on health as a share of total household expenditure or income. Because of the inherent inequality of extreme poverty, of which 712 million people live below $2.15 a day as of 2022, those living in such destitution are often excluded from healthcare coverage. Instead, the international community needs to finance healthcare services of these countries unable to use their own resources and protect the most vulnerable from what could be devastating costs. According to the World Health Organization, the measure of coverage for essential health services includes 14 indicators for family planning, pregnancy care, child immunisation, treatment of children, tuberculosis, HIV/AIDS, malaria, water, sanitation and hygiene, hypertension, diabetes, tobacco, hospital access, health workforce, and health security. These respective indicators form an aggregate index of coverage of essential health services on a scale of 0 to 100, the measure used for Indicator 3.8.1. The second indicator for this target measures the proportion of household income spent on healthcare using a method used by the UN called Classification of Individual Consumption According to Purpose, which categorizes the purpose of household expenditure, including healthcare goods and services. By this measure, two thresholds are used to measure financial hardship, the lower one for 10% of household income spent on healthcare, and the higher threshold for a quarter of household income spent on healthcare. For the purposes of Indicator 3.8.2, this measure is used at a population level to measure the percentage of people meeting either the lower or higher thresholds of 10 or 25% household income spent on healthcare, placing them at financial risk to pay for their healthcare needs. As of 2021, the world result for the index of coverage of essential health services stands at 67 out of a score of 100, still far from the 2030 goal of universal health coverage, the aim of SDG 3 overall. As of 2019, the share of world population with more than a quarter of household expenditure spent on health stands at 3%.